Visakhapatnam is the city of destiny in the east coast of India. The landmark of Visakhapatnam is the Prema Hospital, which is better known as the Mecca of the unfortunate, needy, physically handicapped who are suffering from the dreaded disease of poliomyelitis and cerebral palsy. Prema stands for universal love, and the hospital service is the mainstay of the hospital, also known in Telugu as Seva and Shreyasu. Patients come from nook and corner of the country and other countries by road, rail, and air. This is what the Director General of the hospital and a world-renowned orthopedic surgeon, Dr. Adinarayana Rao, has to say about the activities of the hospital.
We started the Free Polio Surgical Disease Foundation mainly with a motto to make immobile people mobile and mobile people independent. This is our motto. With this motto, we started this foundation under the stewardship of my Guru Dr. D.R.S.V.ADINARAYANA in 1978. First of all, we want to, India is having 60% of the total population of the polio in our country. This population mostly they are confined to the houses only. In house, the mother looks at the polio victim and keep on weeping till the tears dried off from their eyes. So to get solace to the mother and to bring them to in the normal life, we have planned some of the operations and make them mobile and independent. With this motto, we have achieved our concept, that is shape and stability, and the deformities which are developed due to polio and cerebral palsy, we cut the deformity and give the stability to the joints and make them to walk. Especially in India, artificial appliances is very difficult to get it because it's a vast country to develop it, and also we got sandy roads and muddy roads, so that the patient has to walk because with wheelchair and the other things will not go into because of the thresholds in the houses, they cannot go by wheelchair. So the patient has to walk in India too. For that we developed some of the innovative procedures, and with that we have operated so far 3 lakhs patients and screening 20 lakhs patients all over the country. And now we are attracting the people from all over the world. People are coming from America, England, and also developed countries, and also from the developing countries like Africa and all the countries. Now, our main aim is to eradicate the polio. Polio is a disease. Once the disease is affected, there is no cure for it. So they will end in the deformities and they will become immobile. So what we do is we correct the deformities and make their shape and get stability and make them to walk without minimum appliances, so that the patient can live quality life remaining lifetime. The other condition is the cerebral palsy. The cerebral palsy is due to the asphyxia to the brain during birth, after birth also they will get cerebral palsy. This is a spastic one. This is called upper neuron disease. So this is sometimes they get hemiplegia, sometimes they get diplegia, sometimes they get quadriplegia with mental retardation. Though 80% of the people, they got the IQ will be normal. So if you rehabilitate them, they will walk normally and they will live independently. And the other deformities are the congenital deformities. By birth we will get deformities. These deformities again will get the shape of the body and the stability and make them to walk. And we have given pictures of the various patients that itself speaks about our our service to the people. This is what we are doing. Of all these things, most important thing is he is a burden to the family, burden to the society, burden to the country. By rehabilitating them, we are making them productive and useful to the citizens of the country.
Mr. Arun Kumar, who suffers from post-polio residual paralysis and rehabilitated successfully by the treatment of Dr. Rao, welcomes the patients at the reception for necessary registration and detailed documentation. Preliminary medical evaluations are being done by the medical director, Dr. B. Murali Krishna. Then the patient is evaluated in detail by Dr. Rao for the extent of disability and prognosis. Screening of patients is also done in camps. One such camp conducted in the earthquake-hit area of Mandavi in Gujarat state is shown here. Innovative procedures after extensive research forms the surgical process. Needless say that post-surgical rehabilitation therapeutics by qualified physical therapists is a must. The hospital has a well-equipped physiotherapy department with dedicated professionals working towards integration of these patients in the society, improving the quality of their life. Special equipment for nerve stimulation in cases of neuropraxia is also available. Ramnarayan, who has spent 40 years of his life in a wheelchair, is now vigorously working to walk on his own. Use of foot exercises forms the major part in making them stand on their own legs. It is remarkable to see that patients after rehabilitation are able to even climb steps and staircases with ease. Sushma is doing quadriceps exercises and knee flexion exercises, which are very important for squatting and dining in Indian conditions. The artificial limb manufacturing unit of the hospital prepares custom-made prostheses and orthoses to the patients. They are provided on the same day, many a times within 4 hours, so that the patient is not put to hardship. Mr. Mandal, who himself is an amputee, is trained in this art, and who else can better understand the problems the amputees face? Those who can afford get traded in our Polio Prema hospital, which has star facilities for stay and medical care. Mr. Atul Batra, suffering from effects of cerebral palsy, has come all the way from New York for the rehabilitation. His mother Veena has been with him throughout his ordeal and sacrificed her entire life for his well-being. Let us hear what he has to say. His father is Meghraj.
Atul, 2 years ago you had come, again you had come. How did you know that you have to go to Visakhapatnam for this treatment?
I have an uncle in Delhi who is part of ministry, and he had come to the US and wanted to help me to get some kind of treatment in India. So we started by exploring the way of yoga through Baba Ramdev's ashram. Over there, doctors are there. One doctor from there recommended your name to him. Then what had happened, my case history, x-rays and everything was sent to you by courier, and that's how the process was
So
done.
why you have taken 2 years to come back?
Uh, I've been through many operations and medical procedures, and the truth is that I was tired of medical treatment. Had every treatment was hope. It starts with hope, but afterwards you start feeling hopeless. So that I was not mentally prepared for this more operations which you had recommended, 4 operations to me. I was not prepared for that at that time 2 years back. So as 2 years passed, and I was getting more and more tight. So then
How did you convince? By seeing my patients or by seeing my
uh,
believing my words?
I basically was looking at my situation, and it was getting worse. So if in this situation nobody wanted to help me further in US, so you said you will help me and I'll walk, or I'll stand, or I will improve. So that at least I said I tried everything else, I'll try this also.
I think, sir, you gave the hope that you will be able to walk without crutches or with little help.
So
Whereas,
second thing is, you are suffering from cerebral dysplasia. This is called cerebral dysplasia. Mostly it happens with the premature births and seventh month born. See, and I want to ask your mother about your particulars if you don't mind. See, Mummy, is it a full-term delivery or is it premature
no,
delivery?
he was premature.
Premature
Not
delivery.
even 7 months,
Seven months old.
Yeah.
Then has he cried after the birth?
Yeah, he cried. They say he cried, but the cry was very low.
Slow. Then Apgar score is less.
They say it was also very less.
Less. Then AD any fits?
No,
How long he was in incubator?
for 4 months.
4 months. This is the asphyxia to the baby that has produced dysplasia. Since his intelligence is very good, I hope he will improve by my
I hope
physiotherapy and all these things. So, as it is, I have examined him and I suggest him 4 operations because he has got a very tight tendo Achilles, and he is walking on the toes actually, that is unstable gait. So I want to correct the deformities on both sides, and also there is a adduction deformity at the hip joints, adduction. So that also I want to correct it.
So do you think with this treatment he will improve?
Yes, definitely he will improve. The operation is only 20%, and
Okay.
physiotherapy and his efforts are 80%.
Okay.
With that, I have been doing the things, and you might have seen some of the children in our hospital. They have improved, they have gone back.
I've seen many cases you showed me in books, and also I've seen in the hospital that they have improved. But certain questions which I have. Number one is age.
Age.
My age is little bit more than the average patient which you will treat. Right. This is one question I had was age. Second thing which convinced me to go ahead with your treatment was, in previous when I will have an operation means if I'm experiencing some pain or something is getting worse, they will release that, but never with good health. Now I'm feeling good. No, I mean CP is there, but no pain or any acute situation is there. In this situation I've never been operated until now. So that is one thing which, and also your experience and hope which you are giving, should hopefully, if God willing, should
With your experience. and seeing
My
the-
experience is with this shape and stability.
Mm.
See, if you got deformities, the deformities corrected, if I get the shape of the normal body and stability at the knee joints, then people can able to walk. That thing is, you must have confidence on the doctor, and you must have confidence in yourself. So these two things will help you a lot. So since you are intelligent, you are MBA and graduated and all these things, I hope I can assure you that you can able to walk, even if not with little support or without support, time comes. That is my assessment to you.
So let's go ahead with the treatment, and
Yes.
we'll see what the result is,
Yes.
you know, over time.
Yes. Yes.
Thank you very much, sir, for explaining the treatment to me and to everybody else.
How do you feel?
Much improved. I would say 50% improvement is there. And now we're meeting after 6 months, 6 to 7 months, and you are told 1 year. So I think in the balance 5 months, more improvement should take place. You had to just now I'm going to US, and I will be returning to Visakhapatnam later on this year for one more small operation and physiotherapy. Hopefully now I can stand on my own with balance. My body is much less tight, very loose now, and
You were not able to sit like this previously.
no, my legs wouldn't bend, my knees wouldn't bend this much. Also hips and pelvis, back movement, nothing was there. My body was totally tight from years of sitting in wheelchairs and not paying attention to my body properly, body posture, body position. So what happened is you did some small releases, and afterwards 3 to 4 hours a day of physical therapy for the last 7 months have produced these results. Even when physical therapy started, I did not think